Thank you. So our first section today is going to be for both Michael and for Julie to discuss different aspects of understanding urinary incontinence. And first, Michael, we're going to have you go through for us a brief overview of urinary incontinence and its complications.
Okay. In order to understand the complications, I have to, in a simplistic way, try to describe for you how this controlled mechanism of voiding or excreting the toxic substance urine from the body is happening. And then from that, we can go on to see what is going wrong and what are the consequences. So I'll try to keep it as simple as possible. But as I said, the kidneys excrete continuously the urine into the bladder. And the bladder is actually a muscle, and it's also controlled by the autonomous system, something we can't control ourselves. When the bladder is gradually filling up with urine, it stretches a little, and in the brainstem, we call the pons area, it starts to register that we soon need to void, that we need to get rid of it. It's going to fill up. And while the bladder stretches more, the nerve sends out more signals that now may cause contractions of the bladder, and we really feel an urge to soon void. This is all happens involuntarily. It's called the autonomous nerve systems. However, the urethra connecting the bladder to the outer world, where the urine has to pass, is surrounded by a pelvic muscle, or we call it a sphincter, uh, and that is in the default mode is closed and it holds back the urine. So when we come to the bathroom and want to void, the sphincter muscle voluntarily relaxes, allowing the voiding of urine. So here we have a delicate balance of involuntarily contractions and sensations and a muscle sphincter to resist that pressure caused by the contractions. That is a very simple way of explaining it. As you may understand, many things can go wrong in this system, and they do for many of us for many different reasons, and we'll go through some of them here in the seminar. Um, but it can be due to normal life cycle events like age, menopause, giving vaginal birth, or due to lifestyle and some diseases. So we'll go through some of them here to see what can be. So with the age, the wall of the bladder gets a little stiffer, and we may feel that urge sooner and stronger than when we were younger and had better elasticity, especially when the beard goes gray like this. Is something happens to both men and female. These sudden contractions that sometimes causes leaks are called urge, and quite normally also with age you sometimes call them threshold incontinence. You need to go to the bathroom, you feel that quick urge. But it can also be exacerbated by diabetes or neurological diseases like MS, and in men it can appear due to an enlarged prostate. Um, with age, we also produce more urine at night, and we have to get up more often to void. And that's why nighttime incontinence or nocturia and eresis, when we leak at night, is a common problem, uh, also at an older age. And there are some side effects that we have to go up very quickly at night, and we lose our blood pressure, or the blood pressure drops, and we can fall, and it can lead to hospitalization. Um, Another way, if you have, so these are the urges and happening automatic, but there can also be a problem with the sphincter. Let's say you're coughing or you're training and you're increasing the abdominal pressure, you're putting external pressure onto the bladder, and and you can cause a leak. It's the sphincter can actually not hold against that pressure. It can be an external pressure. It can also be the contraction of the bladder. But in the case of abdominal pressure, and you have incontinence from that, we call that stress incontinence. Can also happen in obesity when the tonus and the tone of the muscle changes, or very sometimes with post-vaginal birth, where you didn't rehabilitate after giving birth, and you need to activate the muscles and train them afterwards. And then you can, at quite an early age, get stress incontinence symptoms. And the pelvic wall then is weakened and damaged. And I think Julie can speak more about that. Neurological damage due to MS, stroke, and dementia also affects the central nervous system and its pathways, controlling, voiding both the voluntarily and involuntarily, as I explained. And in serious neurological disorders, where spinal lesion or MS, the muscle sphincter cannot relax, and then you actually have urine retention. You cannot void at all. And after some time, the bladder gets really very extended, and you get overflow incontinence, you call it. So in order to manage that, you actually need to put a catheter in and empty the bladder mechanically in order to control that, or have it at an indwelling catheter. If you combine and in order to manage that, you might want to combine a catheter and an external device at night to control the nighttime leakage. A combination of these conditions, the neurological, where you basically have contractions and you cannot hold the urine at all because of sphincter dysfunction, is called mixed urine incontinence. And that leads to constant leakage, and usually it's worse at nighttime, and needs management for in order to manage that with different ways of collecting urine. We can also see that after radical prostate operation, prostatectomies, due often to prostate cancer, they can have similar symptoms. So this was a very overview on like the mechanisms of the neurological and the mechanical sphincter functions. On the side effects, that's part of the question, I understand, Christy. From urinary incontinence, we have to understand that, first of all, urine is a toxic substance. We don't want it on the skin. We have to get it away from the body. And that's due to the high pH, which is urine is a basic system, and our skin actually likes slightly acidic environment. So the urine ruins the skin barrier, and it causes inflammation, redness, and ultimately wounds if it's not cared for after prolonged contact with the skin. We also see, as a side effect of urine incontinence, often urinary tract infections. It's also often associated with incontinence, and can also be due to hormonal factors, a vulnerable urethra that doesn't close properly, and also the treatment with adult diaper, which you can have contamination inside an E. coli, and that might make you're more vulnerable for urinary tract infection. So you can actually attribute some of the side effects not to the actual incontinence, but to the treatment. So we can separate that also. But there are other side effects which are basically social and psychological, because there's a lot of stigma being incontinent, and that changes our behavior, and that can cause other side effects. So the fear of smell and the embarrassment of wetting yourself, maybe the sexual function will be impaired. You don't feel that closeness, and you have a hard time relating to your partner because of your fear of incontinence. And that can lead to depressions, very common, isolation, depression. And another side effect, on your caretaker, your partner, have maybe to take care of you and help you, or your children. And these are also kind of other side effects you can have from incontinence. And another strategy because of urine incontinence is that you decrease the intake of fluid, because you don't want to load the bladder. And can lead to dehydration and a lower blood pressure, and you might fall. You go up in the night, you fall, and you can break a bone, and you get into the hospital. And these strategies which we have to sort of isolate ourselves and decrease intake of fluid actually worsens the prognosis. So this is very important that we understand why we have it, how we can deal with it. Is there an underlying cause that we need to deal with that? So that's very, very important. Yeah. So